Hello. You want to know all about ACL tears and ACL reconstruction? This is the right video for you. Hello, I'm Professor Manish Kiran. I am a consultant orthopedic surgeon with specialist interest in your bone and joint health. To understand what an ACL tear is, we need to first understand the function of the anterior cruciate ligament. The anterior cruciate ligament is a ligament that's present inside the knee, and it connects the thigh bone to the shin bone. The job of the anterior cruciate ligament is to stop the shin bone from moving forward ahead of the thigh bone. When you have a tear of the anterior cruciate ligament, the shin bone starts moving too far forward, resulting in damage to the cartilaginous structures of the knee, including the shock absorbers called the meniscal cartilage. ACL tears occur when someone is running, they plant their foot on the ground and twist over it, resulting in a pivoting motion. And this can cause a tear of the ACL along with damage to other structures of the knee. They immediately feel a pop in the knee. There might be swelling, pain, and difficulty in weight bearing. The presence of an ACL tear can be found by clinical examination using specific stress tests. Initially, the patient is unable to fully bend the knee, and therefore the test would need to be done in about 20 to 30 degrees of knee bending. But once the patient has recovered from the initial phase and are able to bend the knee, the same test can be done in further flexion of about 90 degrees. The common imaging modalities would be an X-ray to rule out a fracture, followed by an MRI scan to look for the presence of other structural damage in the knee. The most common structures that are involved along with an ACL tear would be the shock absorber cartilage called the meniscus. ACL tears can be managed both non-operatively as well as with surgery. In patients who do not have any significant demands from their knee, who do not have a sense of instability after a period of rehabilitation, and do not have any other damage to the structures of the knee, they may be candidates for non-operative management. The patients who feel a sense of instability, have higher demand from the knee and want to go back to pivoting sports are probably better off with surgery. How long do the patients rehab without surgery for ACL reconstruction? With non-operative management, the physiotherapy and rehab period is about 9 to 12 months. With surgical management and ACL reconstruction, the period of rehabilitation is again 9 to 12 months. If a decision to proceed with an ACL reconstruction has been done, what is the best time for performing the surgery? We know that in the first 6 to 8 weeks, there is significant inflammation in the knee and swelling pain. Therefore, it's not ideal to proceed with ACL reconstruction. At the same time, if we delay the surgery for too long, then secondary damage to the other structures of the knee can occur. So the ideal time for surgical management of an ACL tear with reconstruction is between 6 weeks to about 120 days. What are the graft choices for ACL reconstruction? Broadly speaking, there are three types of grafts. The first being biological grafts from the same patient, the second being allografts, and the third being synthetic grafts. The common biological graft options available for ACL reconstruction are the inner thigh hamstring tendons, the tendon in front of the knee, which may include a piece of the kneecap as well as the shin bone, the quadriceps tendon with or without a piece of the kneecap, and the peroneus longus, which is a tendon on the outer aspect of the foot. There is no perfect graft. Every graft has its pros and cons. The hamstrings are the most common grafts used in the UK. They are soft tissue grafts and therefore liable to stretching over a period of time, particularly in patients who have got hyperlaxity. There is a nerve called the saphenous nerve that's quite close to the hamstring tendons, and it can get stretched during surgery, resulting in permanent numbness on the inner side of the leg. It does not cause any functional deficit. The next graft would be the bone patellar tendon bone graft. It is quite a robust graft with a fixed length of tendon. However, 1 in 3 patients are unable to kneel after a BTB graft, and there is a risk of fracture of the patella or the kneecap. The third type of graft is rather new. It's the quadriceps tendon with or without part of the patella. The risk with quadriceps tendon graft is about 1 in 4 chance of quadriceps atrophy. The fourth type of graft is the peroneus longus graft, which is taken from the outer aspect of the ankle, and this can result in slight weakness of movement of the ankle in some individuals. The longest data that we have available is for hamstrings and BTB grafts. and there's no significant difference in re-rupture rates among the different grafts. The risks with ACL reconstruction are infection, nerve damage, stiffness, swelling, chronic pain, progression of arthritis, and damage to other structures including the shock absorber cartilage like the meniscus. The risk of re-rupture after a successful ACL reconstruction is about 8 to 10%. We have good evidence to suggest that if hamstring grafts are used, then the addition of a procedure called lateral extra-articular tenodesis reduces the graft re-rupture rate by almost 75 to 80%. I tend to use them in younger patients, in more sporty individuals, and in revision ACL reconstruction. When can you go back to sports after an ACL reconstruction? The return to sport rate in primary ACL reconstruction is between 90 to 95%, and after revision ACL reconstruction is about 30%. Most patients undergo about 9 to 12 months of rehab. Previously, it used to be a time-based rehab, but now we have moved to the concept of goal-based rehab, where as the patient is able to achieve the goals, they move ahead in their rehab journey. There is good MRI evidence to show that ACL grafts take about 2 years to fully integrate and ligamentize in the body. This is with regards to hamstring grafts, and therefore the return to sport is ideally done at about 2 years, but it can be earlier depending on how well the individual is rehabbed. I hope that's answered most of the common questions regarding ACL reconstruction. If you have any further questions, please feel free to put them in the comments box. I'll try to answer them. Thank you for listening to this video. Please do like, share, and subscribe so that other patients like yourselves who are trying to find answers to their questions will have access to this educational video and be benefited by it. Thank you.